Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical, and I was going to talk to you a little bit about the way we treat disc injuries here in this clinic. Most common old school way of treatment is just inject the area with steroids, either do an epidural steroid injection, or sometimes they put steroid as close as they can in and around the facet joints, which are on the back side of those vertebrae. I can show you a model here. The facet joints are back here, and sometimes they load those up with cortisone. And cortisone is a steroid, and the side effects of steroids are not really good. It does decrease inflammation, which is temporary. However, it does not do a great job of promoting any types of healing. It actually deteriorates the soft tissue and has been known to lead to additional degeneration and degenerative changes. So the way we treat is very different. We use a non-surgical spinal decompression type of treatment, where if you think about the word decompression, if you have a vertebrae that has been compressed and now that balloon is sticking out like that, I call it a balloon, that disc material has bulged or herniated and is now putting pressure onto the spinal nerve roots, then what you need to do is you need to decompress. So that would be pulling this vertebrae in this direction. So it's compressed and we're going to decompress it. How do you decompress a disc like that? Well, we have an advanced piece of equipment here. It's called a spinal decompression therapy table, and it puts a specific amount of pull, the pounds per square inch, onto the vertebrae above and below the disc that we're targeting. And it actually pulls those bones apart as you are lying on your back. And it's a comfortable feeling. It's not a chaotic feeling, or it's not a medieval stretch where it's gonna rip you in half. It gently pulls those two vertebrae apart, and by doing so, it's creating negative pressure. It creates the pressure on the outside to be greater than on the inside of the disc, and so it pushes that disc material back to where it needs to go, towards the midline. So if you can imagine a person who maybe was using some shampoo in the shower or some hand lotion, and they got way too much, and they think, oh no, I don't need all of this. And instead of just washing it down the drain and starting over, I'm going to squeeze some air out of the shampoo bottle, and I'm going to put the lid, the opening, close to the shampoo, and I'm going to suck it back inside the container. So what we did in that situation is created a little vacuum, a little negative pressure, and it pulled that back. So decompression therapy goes beyond just creating zero pressure, just pulling it apart to where now there's no pressure pushing on that disc material, but it goes further and creates negative pressure, which actually draws that disc material back towards the midline. It's very effective. It's like over 86 or 7% effective at decreasing your risk for surgery, whether you have a bulge or a herniation, whether you have it in your neck or in your lower back. This type of therapy can help. Not only that, but here in our office, we offer some other treatments that include some balance training and some core strengthening and some different things that you would think look like physical therapy, even though it's probably more like functional movement therapy. We also offer some chiropractic adjustments, because if those vertebrae are misaligned and you're going to stretch them apart, you're not really realigning them. So the chiropractor, using his hands and some instruments and some special tables, can actually get that disc material to kind of line up better while the vertebrae are moving and shifting and balanced more side to side, which is very important, because what made the disc herniate towards one side, in that model I was squeezing, it was the pressure on the other side that was causing it to herniate on the first side. And so if we can't fix that pressure imbalance, then it's going to herniate again. It's going to rupture again. It's going to potentially get worse. So we actually pride ourselves in probably shooting a little bit higher than the 86 or 87% effectiveness of the machine, because we have countless patients, hundreds and hundreds and hundreds over the last 25 years, that have gotten a lot of relief And when you're on the table, it feels amazing. It doesn't hurt. In fact, we have people say that the only time they have relief is when they're literally lying on their back and nice and controlled and relaxed. We have others that just go straight to sleep whenever they get on it, because it begins to relax the spine and remove that pressure. And over time, post MRIs of the treatment have shown that the disc material actually retracted. And I've got one MRI report that shows the neuroradiologist who read the second set of films actually commented in the section where he puts comments, and he says, "I do not know what would have caused a retraction of disc material that I saw on the first MRI." So if you have an MRI that shows a disc bulge, it does not mean you need surgery. Check us out if you'd like more information on non-surgical spinal decompression therapy. We're right here at Trinity Integrated Medical. That's trinityintegratedmedical.com. And it's Dr. Tim wishing you the best. Take care.